Off.
Good evening, everybody, and thank you so much for being here. I'm glad we're able to start just a few minutes early from our 6 p.m. town hall. Just kidding, of course. Thank you for bearing with us as we get our technology straight. We obviously have over 1,000 folks on Zoom and many, many more on Facebook Live joining us this evening. I'm really happy this evening to be able to share with our community, our staff, our parents, our students, our reopening framework for the August 17th opening of school. I know that even some of our trustees couldn't make it into this Zoom because of how many people have come so quickly, and we appreciate them. And I want to take a moment to really appreciate Trustee President of the Board Hernandez Jarvis, Trustee Consuelo Lara, two folks who've been on our task force working on these issues, Trustee Mr. Phillips, Trustee Tom Panis, and Trustee Val Cuevas. So we thank them for being here this evening. We have a full agenda for you this evening, and we want to go over some of the particulars in terms of how folks can access this in Spanish. And I'm going to ask if Mr. Walton can bring that up for us to be able to see that. Thank you very much. So in front of you, you will see steps to hear the board meeting in Spanish. And so you see that right in front of you. So in your meeting or your webinar, please click interpretation, and then you can click the language that you would like to hear. And then there's an option to only hear the interpreted language. You can click the mute original audio. So today we ask you to help us abide by our norms for this discussion and this meeting. And that's keeping our students at the center, being tough on the problems but easy on people, listening to understand, and being solution-oriented. What we're going to do this evening is we'll share a little bit about our timeline and the task force that's been working on our reopening plan, hear from County Health about the current conditions, learn from our community engagement partners how we've engaged our community in this process and what we heard, share our return to school framework, and then go through our next steps and closing. So what are we out to do tonight? 3 things. 1, to share our reopening concept with the community. 2, to inform you of the community engagement efforts that have taken place. And finally, the last part of our meeting is to gather feedback and information to inform our next steps. So we'd like to get a little bit of information about who is joining us today. So we know that in the Zoom, there's 1,000 people, and there's many, many, many more on Facebook Live. So we're going to ask you a series of questions in the Zoom poll that's going to come up. What best describes you is the first question. And these questions will just help us get a little bit of an understanding of who's with us this evening. We get a sense of who's in the community and who's joining. Great. So you'll see in the poll which best describes you, where you live, and what level your student is in. Those are the 3 questions we'd like to know this evening. So if you're able to take that poll and quickly for a minute or 2, just click in there and let us know the answers to those questions. It will help inform how we move forward this evening. If you're watching on Facebook Live, you're welcome to put that in the comments and we will sum those up as well. So thank you very much. We'll give about 1 more minute for this. And we'll move forward. So thank you again for taking the time to do that, and we'll move into the next part of our presentation. So just a quick note, we're seeing about 71% of our participants tonight are parents or guardians, another 20% staff members. We're seeing a pretty even representation across our communities, but a little bit more from Richmond and El Cerrito. And then about 50% of our families are of our elementary students, 10% middle, 22% high, and about 10% families with more than one child. Great, thank you so much for filling that out. That really helps us get a sense of who's in the room with us this evening. Thank you. So we're going to move back into our slides. I wanted to tell you a little bit about our return to school timeline. So as soon as we finished school, or as we came to the close of school in the spring, we began to survey youth and family and parents about their experiences with distance learning and their thinking about both school in the spring and school coming into the fall. We did a ton of data analysis with that data in the first weeks of July, and we released a draft framework just a couple of days ago. Tonight is the first time we're publicly sharing that framework with the community via this town hall. At the end of this meeting, we'll take feedback, and we'll continue to take feedback over the coming week, and we'll bring all of that to our Board of Education meeting next Wednesday. On the 20th, we'll submit our plan to the county, and on August 17th, we'll be ready for the first day of school. So tonight, you will definitely see a framework and not a detailed plan that fleshes out what we're doing minute to minute. That is our continued work over the next few weeks. But today and tonight, we really wanted to make sure the framework of where we're going and how we're doing our work is clear. This is just one phase of the process. We had a task force of 32 members and subcommittees that worked on 4 areas: health and safety, operations and facilities, communications, and learning. I'd like to show you a picture of Washington Elementary School right here in Point Richmond in 1918. And in this picture, 100 years ago, you will see students wearing masks as they worked through the influenza epidemic of that time. And here we are 100 years later working through a similar pandemic. So schools have been there before, and we will get through it together. Tonight, I'm honored to introduce a number of members of our community who have played a key role in the community engagement process so far. Sorry, before we do that, let me go back and say, how did we do our community engagement? We did it through outreach. We did it through youth truth surveys to students and families. We did it to parent leaders through our Parent Leader Council, student leaders, surveys, working groups, many ways we've been engaging the community over the past 6 to 8 weeks. We'll hear from our community engagement leaders in just a few minutes. We can go to our next slide.
Good evening, everyone. My name is Martine Blake. I'm the Director of Community Engagement. Really quickly, thank you for sharing some of the efforts that we've made to engage the community, Mr. Duffy. I want to shout out some of our partners that helped to make that happen, including Healthy Richmond, which collaborated with our PLC to host 2 parent town halls, our Youth Truth survey providers, our surveys, and of course, our youth and our parents. And so over the past month, we've really been spending time hearing from our students and our families first, really putting them at the center of our engagement so that we can understand what they need to feel successful during this time. From there, we lifted their high-level themes to staff to talk about what do we have the capacity to respond to now, and where do we need support from the broader community to help us build capacity internally, as well as supplement our core program. And so moving forward, you'll see us focus or have more engagement with the broader community so that we can develop an integrated response based off of the needs that our parents and students lifted. And then from there, as we operationalize our plan together, we'll have opportunities to continuously engage with the community to kind of pulse check, let you know what's going on so that you guys aren't out of the loop and you have an opportunity to continue to give input. Next slide. So who did we hear from? We launched a Youth Truth survey and we heard from 3,300 students. Our youth task force supplemented that survey and we heard from another 380 students. We launched a family COVID survey and we heard from 7,000 respondents, which is incredible. This data really shows that you guys were in it with us. You wanted to give this input, you wanted to engage in this process. These responses are higher than what we generally get throughout the year, so thank you for that level of feedback and engagement. Our Parent Leadership Council also supplemented the district survey with a survey of their own. UTR and Teamsters also launched a survey where we heard from about 900 of our staff. So from here, I'm going to turn it over to Shakira Reynolds, who is a member of our Parent Leadership Council.
Good evening, community. I am Shakira Reynolds, and I am a member of the Parent Leadership Council. We are a council composed of the officers and members of the 4 WCCUSD Parent Advisory Committees, ASAT, MDAC, CAC, and DOCAPS. We came together to find common ground and create goals and strategies to provide input to lift up the needs of our most vulnerable students. We created this survey because we wanted to hear from parents about the issues we felt were most important to share as reopening was being discussed at the district level. So there were 1,022 parents who responded from our survey during the week it was open, and roughly 45% of survey respondents were parents of low income, English language learner, African American, special education students, and foster and homeless youth. 49% of respondents were parents whose students are not categorized above, and 6% declined to state. Just over 82% of respondents said their children were definitely returning to our district in the fall. Next slide, please. So, how do you feel about continuing distance learning? Just under half of our parent respondents said they were ready and could continue to support their children with distance learning. But most importantly, over half said they would need additional support, they have to work in order to continue distance learning, or they may have to pursue other options. And so it was clear to us that our parent community would need support in order to continue with distance learning. Next slide, please. If distance learning continues, what changes would you like to see in teacher, school, or district communication? And the top 3 responses were more phone calls, emails, and texts from teachers, a consistent schedule, which is contact on a set day from teachers, and a consistent schedule from the school sites. Coupled with the rest of the data on our survey regarding communication, there was overall a desire for more direct and consistent communication from the site level. Next slide, please. How many hours a day, Monday through Friday, do you feel would be reasonable for your children to engage in schoolwork during distance learning? For the early year students, it was 1 to 2 hours. Primary was about evenly split between 1 to 2 hours and 3 to 5 hours, but it was very telling that from upper elementary through high school, most parents felt that 3 to 5 hours a day was a good amount of time spent on distance learning. Next slide, please. What parents are concerned about? The number one concern was social emotional needs. Nearly 50% of respondents stated they would like social emotional resources and academic materials that address current events, trauma, and current life experiences. They were concerned about quality instruction. I'm worried that the curriculum is not ready to teach students. Consistency. There needs to be clear and consistent expectations from the teachers and schools. Just over 39% of parents said they would like to see a reduction in the number of digital learning platforms, and the majority would like consistent schedules and more live teaching. Sports and PE. Over 45% of parents would like their students to have virtual or socially distanced physical education. I'm worried that our kids will no longer participate in sports. These are important community events that keep us connected. And balancing work and students. I am worried about childcare, working and monitoring my child, and balancing the learning of multiple students. From the Youth Truth Survey data, the highest need from parent qualitative comments were for tutoring, and another high need was for more breakout groups and smaller class sessions. There was also a trend in parent responses that distance learning was not working for K through 2. Next slide, please. And finally, equity matters. The vast majority of parents with special needs children reported that their students did not have access to the support services included in their IEPs, such as RSP, speech and language, occupational and physical therapy during distance learning. Parents of English language learners felt the most important factors to consider during reopening to best meet their needs were parent tutorials of digital platforms in different languages, translation support for teacher-provided lessons and communications, and culturally relevant and bilingual enrichment materials. Almost 70% of parents said they would like more lessons or activities that are not screen dependent. 55% wanted material kits and virtual or in-person tutoring provided, and almost 40% want more culturally relevant materials. According to district data, the vast majority of students who missed 5 or more weeks of distance learning were English language learner students. So in all of our planning and processes, we have to make sure to lift up the communities and students who need us most. And also, I'd like to remind us about the needs of parents with special needs. And with that, I'm complete, and I'm going to pass it to Dawit and Stephanie and Simone and Yael. Thank you.
Thank you very much, Shakira. Hello, everybody. My name is Dawit Vasquez-Simula, and I helped lead the task force. I'm really proud of the task force, of the student task force. We have done so much, from making our own survey, because we understand that like other youth will understand us better and our surveys better, to a certain extent, to leading a forum last Thursday where we could have any student from the district could show up, and we had Mr. Duffy there so they could ask questions, and yeah, and they could say whatever they needed to, any concerns, any questions that they had, any comments. So we've been putting a lot of time and effort into this. We're gonna start with another one of our another person on the task force. They will introduce themselves before they speak.
Hello, my name is Yael Gutierrez, and I am a rising senior at Richland High School. So our question was, how has your mental health and or stress levels changed since the shelter-in-place order and start of distance learning? Through this pie chart, overall, distance learning had a negative impact on students' mental health, most students' mental health became negatively affected because they had to adapt to a new work environment. Those who claim it had a positive impact state that their stress levels alleviated because virtual assignments were due at the end of the week. According to the district's Youth Truth Survey, 50% of students reported that stress, mental health, and anxiety were a barrier to learning. Also, a higher proportion of Youth Truth's female respondents and respondents who identify in another way experience feeling depressed, stressed, or anxious as an obstacle to at-home learning as compared to male students. It is important to take account the health of each student. Next slide, please.
Hello, my name is Stephanie Garcia. I'm a rising senior at Richmond High, and our second question was, how are your grades affected by distance learning? According to the survey, 40.1% of the students reported that their grades got worse during distance learning. However, 37.2% of students said that their grades were not affected. Next slide, please. Here, over 65% of the students that took the survey said that they learned less. And that is key to our last slide, because even though some grades were not affected, the learning did decrease. This shows inequities and differences between grading and learning. On average, Black and Latinx students faced a greater number of obstacles than did white and Asian students. SPED students struggled more, feeling less connected overall during this time, and students from low-income communities, special education students, and students who are English learning had less positive experiences accessing, completing, and turning in schoolwork. Next slide, please.
Hi, I'm Simone, and I'm a rising senior at El Cerrito High School, and I'm going to talk a little bit about distance learning and what we've gathered from students. So what was effective? Time management. A lot of students were able to figure out ways to self-study and create their own schedule that kept them organized and on track. Another thing was flexibility. All work for some schools was due at the end of the week, which reduced stress for a lot of students. Something around mental health that worked well for students was that a lot of them were able to get more sleep during this time, which is really important. And a lot of students liked the different technological platforms that were used, like Google Classroom and Remind. Things that weren't effective were technical difficulties, whether that was because of student Wi-Fi or teachers not knowing how to use certain online platforms like Zoom or Google Classroom. Another thing was lack of communication. A lot of teachers and counselors at different high schools were hard to reach, which created stress for students. Another thing was having an overwhelming workload. The transition, to distance learning was really hard and challenging for a lot of students, and changing to all that work online was often tedious and time consuming. And then a lack of motivation, and a lot of this was caused by not a lot of teachers using Zoom or having inconsistent Zoom schedules. And I think Zoom kept students motivated and allowed for that social interaction with their classmates. And then how schools could improve. So organization, teachers having daily Zoom meetings and reviewing assignments and giving clear instruction, and teachers holding office hours so that students could get that one-on-one time. Another thing is keeping students motivated. So work that allows students to work with their peers and have that social interaction and keeping them engaged, and providing resources like hotspots and having clear communication about how students can access these things. Next slide, please.
Dawit, I think you're muted.
Oh, no, I'm sorry. So in order to hold the district accountable, we made a few demands, and here they are. Yeah, and so a few of them were making sure that grading could be chosen by the students, because we know, because of our different backgrounds, because some kids are working, because there are a few different things in our way. If kids had the choice of whether they wanted pass or fail or a letter grade, that could really help significantly. Teachers having technology training and orientation before the school year, that was a huge issue, where teachers sometimes didn't know how to work whatever platform they were using. So there are a few different demands on there that I'd hope the district will look at another time. Thank you. I'm going to pass it back to Mr. Duffy.
Thank you very much. And I just wanted to confirm with Ms. Blake, and I wanted to make sure we got a good moment to introduce Martine Blake, who is our Director of Community Engagement and has helped coordinate a lot of the different community engagement efforts between parents and students. Martine, was there anything else that we needed to report there, or are we good in this section?
I think we're good in this section. I do want to note that our teachers obviously are also at the center of our work. They are very critical and important members of our team, and that input will be reflected later in the slide deck.
Absolutely. And when we talk later in the slides, you will also see much of the input from our teachers, parents, administrators, and our teachers did tremendous work as well. And we'll talk about that a little bit later in the heart of the slides. So now I'm really happy that we are able to have two members of our county health team with us tonight. And one is somebody many of us know well, and that's Supervisor John Joya, and he is with us. And also joining us is Dr. Rohan Radhakrishna, who is our county health lead. And I've had a chance to talk to him on a number of occasions with our county superintendents and really learning what the county is seeing in terms of health and how it's directing us forward. So I wanted to introduce and bring Dr. Rohan into this meeting with Mr. Joya to give us a brief update about what's going on health-wise around our county to help continue to frame this discussion before we get into the synopsis and the framework for opening school. So Dr. Rohan, thank you very much.
I think I'm starting, Matt, and then
Okay.
I'll
Great.
Rohan. So
Thanks,
Superintendent Duffy, and I want to welcome the West Contra Costa Unified family. Like most of you, I'm also a parent, and my daughter is starting her junior year at El Cerrito High School, and we are all looking forward to a safe and healthy reopening of our schools. And I know and appreciate that the school district is working hard to make sure it's possible for all of us as parents to have our children go to school in a safe environment. And this town hall is very important in really hearing from the community on that regard. I know how challenging this environment is for all of us, but I'm really proud of how West Contra Costa has really stood together, responded, and really protected the most vulnerable in our own community. The one message I really want to make clear is that for us to successfully reopen, we want everyone to get tested. It is really important to see the extent of the virus and then restrict its spread by understanding who's tested positive. In that regard, I want to say we've had a great partnership with the school district. We just opened a new testing site at Kennedy High School. It is available. The testing is free. It's easy. It's a self-swab. It's not the type of test that is more uncomfortable, which was in the past. And it allows us to really get a handle on where the virus is. We also have a location at our West County Health Center in San Pablo and at our Pinole Library, of course, in the city of Pinole. So please get on the county's website, and there's a phone number or an online method to get a test. And let me stress that that is most important in really helping us reopen, whether it's schools or businesses. So with that, I'm going to turn it over to one of our health officers. We call him Dr. Rohan, and I know he has worked with many in the Richmond community, both in Spanish language and in English language. So Dr. Rohan.
Thank you so much. A pleasure to join you all this evening. My name is Rohan, and I stand for love, transformation, and equity for all people. I'm a student of Pablo Freire, who wrote Pedagogy of the Oppressed, and I believe that education leads to liberation, and liberation leads to health. So your mission is our mission, And I'm really grateful for the deep partnership between the education and the health sector. I come to you as a parent of 2 children who are school age. I come to you as a manager of hundreds of workers, understanding the challenges of unions and keeping our staff safe. And I come to you as a doctor in your community that cares for 1,000 West Contra Costans. Some of your families are part of my panel. And the truth is, my true patient is the entire county, the whole 1.1 million Contra Costans. And we've been working several times a week with the whole education sector to work on these guidelines and frequently asked questions to keep schools, the students and the staff as safe as possible as we start this process of slowly opening society and schools. So I'd like to briefly talk about prevention and data. And I did put into the chat 2 important resources that you can follow along. The first link is that of our website from cchealth.org, which has our dashboard, and you can follow along with all of our metrics. Some of you are very statistically and data savvy and can follow based on place, based on race, based on age, what is the status of the epidemic in our backyard. It also includes the multilingual call center that's 24/7 in any language. It goes to 211 and after hours for any questions you have about COVID-19 and the orders and guidance. And finally, the Get Tested phone number where you can actually schedule an appointment to get tested no matter where you live. The second resource I posted there is very important, and it comes from a friend and colleague of mine, our State Surgeon General, Dr. Nadine Burke-Harris, who is a pediatrician. And given that your survey said that 50% of parents were concerned about social and emotional factors, given Yael and Stephanie's great presentation and Simone's about the concerns of the social emotional impact of distance learning on our youth, I really want to share this resource with you, which is the Surgeon General's playbook on managing stress for children during COVID-19. It has a lot of great resources and references, whether it's for mindfulness or handling trauma and anxiety, which increases during the times of a pandemic. And so please use that resource for your families. I'm glad Superintendent Duffy showed the photo of 1918 and the influenza pandemic, because it's telling us that we've been through this before and we'll go through it again. Climate change will bring many disasters, whether it's power shutoffs and wildfire smoke, or more migration of humans, vectors, mosquitoes, and viruses. So we will face other emergencies, and the more united we are as a community, using technology, hearing community voice, being flexible and dynamic, the better poised we'll be able to handle challenges throughout the upcoming century. So I'm proud of our partnership so far, and really excited to hear the engagement and feedback from all the surveys, which is seemingly spot on from what I see within my clinic. So let me start by talking about prevention, and then I'll go to the data. Prevention is key because in the absence of a vaccine in the arm, and even when that comes, there is still some distrust of government and of health. The best we can do is the key for prevention measures. So I want all of you to repeat after me: face, space, hands, home. Say it with me. Face, space, hands, home. Ahora en español. Casa, cara, manos, pies. Casa, cara, manos, pies. So face, space, hands, home. Let me break it down a little more. The importance of a face covering is essential. If 80% of people were to cover their face 80% of the time, we would decrease 80% of the virus transmission. It's almost as good as herd immunity from a vaccine. It's the best defense we have from spreading those invisible respiratory droplets. It doesn't have to be coughing or sneezing. Even talking can pass that invisible enemy of the virus. So we do need to be good community ambassadors of covering our face. Other countries in Asia, Singapore, Taiwan, Hong Kong, have been able to move forward in opening society because they have a deeper history and more cultural adoption of this key prevention measure of covering our face. I'm proud that our county was one of the first, and we know it's become a political hot button issue. But the more you can be ambassadors in your family and in your community, the message is no shirt, no shoes, no service. And now it's no shirt, no shoes, no face cover, no service. And that's because of the powerful science that it is the best tool we have to decrease the spread of this this virus. So please cover your face. It doesn't have to be an N95 or a surgical mask. It can be a bandana or a cloth face cover, nose and mouth as well. There are some exceptions based on disabilities noted in our health order, but that is our best defense. It's actually an act of love and compassion that my mask protects you and your mask protects me. And we're going to be living with face covers for many months. So the sooner we can adopt it, the more we can continue to crush the curve and keep the numbers down, although it is rising this summer, as I will share. So that's face. Second is space. Maintaining that 6 feet can decrease the spread of those invisible droplets. And if there is a positive person, it doesn't mean that the whole environment needs to be quarantined and isolated if you were able to maintain that 6 feet of distance, which drastically reduces risk. So face and space. Hands and home. Hands, old school public health. Washing your hands for a full 20 seconds, all sides. Imagine you just held a stick of butter and you got to get that coat off and really scrub hard, all sides. The thumb that touches the doorknob is old school public health and is very powerful. So continuing for the rest of our lives for all threats, norovirus, influenza, to wash hands thoroughly and effectively is very important. And finally, home. When in doubt, don't go out. Play it safe, stay home if you're staff or if you're a student. That means going to the grocery store, going to any type of event, and going to the school environment. So along those lines, we do have references from the state around symptom screens, so people can check for symptoms at home before going to work or school to make sure they don't have any of the symptoms, because the science is changing. We now know that losing your sense of smell and taste is a symptom that may be a sign of COVID, so you'd want to play it safe and not go to school if you're having those symptoms, as long as the other common ones. In addition, temperature screening is a hot topic. It's not something that we require or necessarily even recommend, but it is optional. When you're using the laser gun and pointing the infrared thermometer, there can be a lot of false positives and negatives. So we're not mandating it or requiring it, but you can do it. 100.4 Fahrenheit is still the cutoff. So even if you're feeling sick or you have a fever, please stay home to protect your family, yourself, and others in your community. So that's face, space, hands, and home. Casa, cara, manos, pies, the key prevention messages. Now let me talk about the data. And unfortunately, it's not great this month. There's 3 numbers in particular that I'm concerned about. That's the number of cases per day. That's the % of cases that are positive. And that's the number of hospitalizations. And I'll talk a little bit about West County in particular. But for the entire county, we have now tested more than 91,000 Contra Costans out of 1.1 million. That's about 8%. That's great, and it's not enough. We need to be testing more to really understand how the virus is in every zip code, every census tract, every city, to better inform our response and our decisions to keep the community safe. Now, out of that 91,000, almost 4,500 have tested positive. But the truth is, we know about 5 to 10 times as many people have been infected. We just didn't have the federal support to test in the early months, so we do expect it to be in the tens of thousands that have contracted the virus this year so far. 88 people have died in our county. And while that is 88 too many, we do need to put it in context with the other economic, social, emotional impacts of the stay-at-home orders and keeping society closed. We're seeing increases in our crisis call hotlines, child abuse, intimate partner violence from people being caged in at home. And we want to get people out to the parks to exercise, to go back to society, but to do so in a safe way. So every day we're reviewing the data. We're not flipping the light switch on. We're slowly turning the dial up and opening things. And we're actually pausing. We're not opening indoor dining. We're not opening nail salons like we were hoping to in early and mid-July because of this increased rise. It's more of the end of the beginning wave than a second wave. So we consider it a surge within the first wave rather than a second wave that's going on right now. So that's the first number, the number of cases. It used to be maybe 1 or 2 dozen. And now our 7-day average for the number of positive cases per day is almost 150. So that's close to a 10-fold increase within the past 2 months. The second number is the % positive. So out of testing 100 people, it used to be that 2 out of 100 were positive, and now it's closer to 8 out of 100 are testing positive. So that's almost a 4-fold increase within the past month. So there is more virus transmission in our communities. The third number is hospitalizations. We call that a lagging indicator because it gets a couple weeks to get sick enough to end up in the hospital. Whereas 15 people used to be hospitalized in our 9 hospitals, or maybe in Kaiser Oakland that we're getting the data from as well. Now it's more like 60 to 70. And so that's also about a 4-fold increase in the number of people who are sick enough to be in the hospital from COVID-19. You may see in Florida that ICU beds are getting filled. That is one of the measures that you can publicly see on our transparent dashboard and follow along. We're doing okay in terms of ventilators and hospital beds, but we are tracking it and seeing that rise. So those are 3 concerning numbers showing that the virus is spreading more. When it comes to West Contra Costa, you may have heard that we are 15% of the population, but we actually have more like 35% of the virus burden in the number of cases. So that's almost double or triple an inequity compared to the rest of the county. To break it down, the number that we use per city is how many people per 100,000 have been positive. And while for the whole county, it's 422, for Richmond, it's 824, or about double. And for San Pablo, it's 1,334, which is about triple. So we know that inequities exist. You may have heard that your zip code can determine your health more than your genetic code. Place matters. And we know that in West Contra Costa County, we have more families from multi-generational households. We know that people have been doing essential work, and we're grateful for that. To our Black and brown communities, our low-income populations that have been working in the transportation, grocery, frontline service industry, keeping our economy and our society moving, but that does come with risk as well as greater health inequities to begin with. So yes, West County is higher risk, and we're working closely to do our best to try and address that. So that's a breakdown of the numbers. We don't want you to be afraid. We want you to be prepared and know that we've been through this before. We'll go through it again. You're in good hands, and there's excellent collaboration between education and health to help your education sector make the best decisions. So finally, when it comes to the guidance, the California Department of Public Health and the Department of Education have recently issued guidance for elementary as well as secondary schools. And you can go to the County Office of Education to see the reopening guideline document and the frequently asked questions that was co-developed with the health officer team. We will continue to support school leaders in their decisions around reopening under these existing guidelines that you all can read, but we will not be approving every plan for every school or every district. We trust you. You're the local experts. We're here to interpret the data. The prevention message is the same, those key 4 things for the entire state. We don't want to reinvent the wheel at the local level. Your students, your parents, your staff are your experts, and they've already gathered the survey data around what the needs are. So we will continue to work with you so you can safely reopen to address the needs. So I want to end just by saying a deep thank you. What you do is so key for health in the education sector. It's social, it's emotional, it's long-term liberation of our youth, our future leaders. So thank you, and we're here to continue to support you in the long term.
Thank you so much, Dr. Rohan. Really, really appreciate it. Appreciate Mr. Joya as well. Thank you for giving us both a snapshot of what's happening across our county and in our community, and the 4 face, space, hands, home acronym that we can begin to use as much as possible. So thank you very much. We really, really appreciate it. And we're gonna now pivot and really begin to dive into our reopening framework for August 17th when we do open the schools. And while we, we're able to hear from our parents and our students about the engagement, I really, really want to thank our staff for their contribution to the next part of the plan that we'll hear. It was contributions from everybody, but so many staff, both teachers, administrators, classified staff on our task forces and working groups helped us get to this point. So it's my pleasure also to introduce Tom DeLapp. Tom DeLapp leads an organization called Communication Resources, and Mr. DeLapp and his organization have helped us project manage this process. They have also teamed up with another organization called Colibri Collaborative that's also been helping. And Communication Resources has helped us build this framework by helping to collect so much of the data, put it all in one place, and tell the story that we need to tell. So I am pleased to introduce Tom DeLapp. He's going to walk us through the slides around our opening plan, our opening framework, I should say. We'll build the implementation plan as we go over the coming weeks. And after Mr. DeLapp presents, we'll have an opportunity for everybody watching to give some feedback on what they heard and share some ideas through a tool called Thought Exchange. So we'll wait for Mr. DeLapp to come on and we'll move that forward.
Well, I'm glad to be here. These difficult conversations that we've had, but they're important ones. I was struck in the process of how we have worked with the district over the last several weeks on how innovative and thoughtful and collaborative the community of West Contra Costa has been as it has approached this very, very difficult topic about coming back to school. And I have to say that we need to make sure that everyone appreciates that we are not going to be opening school as you know it. The way I first approached this in thinking about our plans was we're still in a crisis mode. And so we're doing a temporary fix to get us to a transitional place on how we're going to operate heading into 2021 and beyond. So what we are doing is we are launching a distance learning model with a phased startup to in-school instruction. We clearly want schools to open. We need schools to be open, and we must do that safely for all of our students and employees. Our goal is really safe schools and safe spaces. And one of those goals is to make sure that we leave no child behind in our process. So our opening plan development process involves 4 steps. The first, which we're just concluding now, is step 1, which was to do strategic listening, to set priorities and problems, identify perspectives that are out there, and to raise up the possibilities of what we might do. Step 2 was to take those, develop key concepts, and then to put forth a conceptual framework for opening schools and opening instruction, and then provide for opportunity for revision and feedback. And that will be happening from today on into the middle of next week. Then what we're going to be doing is step 3, which is to use implementation teams, and we're convening those starting next week, to get into the details, the specifics, the action steps that we need to operationalize this framework. This is not our plan. This is the conceptual framework. The details of the plan of how we're going to move forward are going to be coming over the course of the next couple of weeks and on into August. And then the final element is to make sure that we're communicating effectively to inform, to orient, to train people, and to engage them in the process from July 20, when we submit this to the county, on through the start of school and on into the fall. And it is important that we realize that we ensure that stakeholder voices are heard and that continuous improvement takes place. That has been a hallmark of the school district. So, the planning environment, let me kind of give you a feel for what we think is going on relative to issues that are going to be affecting our decision. And these are things which in some cases are out of our control. Will the surge of COVID-19 infections continue to spike in August? And there's some indications that it's going to. Will the governor's stay-at-home order be reimposed prior to our start date? Will the state order to close schools like they did in the spring, or they actually ask for a delay in the start times? How specific will CDE guidance be on requirements we need to meet? And are we going to have enough PPE and testing kits and other safety materials on hand to affect our decisions about having in-school instruction? Some other factors include this: state and federal emergency funding. Is the HEROES Act going to make it through Congress and get signed? We've had some indications that there is some movement, but there's also indications that it's being blocked. How are neighboring school districts deciding to reopen? And everyone will be comparing, what is this district doing against that district? And let me also say, a survey that was done a couple of weeks ago by a national news organization, 95% of the superintendents across the country said that they really have very, very confused ideas about how we can actually open schools right now because they're not getting coordinated direction. It will be important for us to be sensitive to and responsive to what has been happening since the death of George Floyd. The Black Lives Matter movement is going to be reflected in our schools, and it has triggered deep and meaningful conversations regarding equity. And equity is one of the cornerstones of our framework. And that's important for people to understand. Will there be teachers and substitute teachers shortages due to stay-at-home orders? And will our disadvantaged families become even harder to reach? These are concerns. So some other voices that are pressing for reopening schools are the American Academy of Pediatrics, which is saying basically that the distance learning downside outweighs the threat of coronavirus infection among children. It doesn't lessen it among adults. The President of the United States and U.S. Department of Ed are pressing for in-school attendance and even threatening to withhold funding. Governors in Florida and Texas are now mandating their states. Governor Newsom has not done that in California. And the argument that is clearly being made is that we need to free parents to work, and we need to deal with the detrimental effects to students of this isolation. That is the rationale driving the notion that we have to be back in school. So, do we have to reopen school? There's no state mandate for in-classroom live teaching going into the fall. What they have said is to the extent possible. And what that means is that everybody's pushed the decision right back down to the local school board and the local management teams in schools. No one wants to take responsibility for making the call, except leaving it with the school leadership. So we have two key triggers. The first trigger is whether we're going to actually open fall in the fall, and we have to use the best science and the best health guidance for that. Are we going to be back into lockdown? Will we have schools included or exempted from that? And is this second surge that's coming in on COVID-19, is that going to be flattened or is it going to be spiking going into August? That's our first decision. So even under this framework, external conditions may mitigate the idea that we can do anything in schools. And that's unfortunate. And we can all play a role in keeping that from happening. The second big trigger is that once we come back in, and many other school districts that are doing plans where they're going to be doing some sort of in-classroom for everybody for certain periods of time, certain days of the week. Once we are in school and we've started doing that, will we be forced basically to close again? So these are the considerations that are going to be our factors that we have to decide. Are we going to not start, or are we going to have to close once we have started? In any work like this, we have to be guided by core values and guiding principles. And these are the ones that the task forces work so hard to develop and to adhere to in their work. Supporting the safety of students and our staff in a healthy learning teaching environment is the number one thing that everybody has told us. Strengthen the social, emotional health and well-being of our students. Promote equity and achieve equality of educational opportunity. Overcome the digital divide for disadvantaged families. Adequately feed our children nutritious meals. Create a culture of connectivity and collaboration in this new schooling environment. provide families with educational options that can meet their unique needs, and inform and engage stakeholders with timely, reliable, and accurate information. Underpinning all of this is we need to provide professional development, training, coaching, and support to our staff and parents on how to master distance learning. So the key questions for us in this plan are, can we create one that is flexible enough to address the unique needs of schools and students, adaptable enough to adjust to changing circumstances and conditions, and nimble enough to pivot to a fully online learning model without jeopardizing equity and accessibility for all students? Our job in working with the school district was in the step one to triangulate all of these input streams, harvesting perspectives, priorities, and problems. And we worked with the task force to get a lot of stakeholder views to make sure that they were communicating with us all of the perceptions, the needs, and then working with our cabinet in the school district and also those 4 subcommittees that the superintendent mentioned to really drill into what are some of the implications. And they've done some remarkable work coming up with suggested things that we can do to achieve our goals in this. And then finally, to engage, to do some other engagement, which includes more focus groups, a thought exchange survey, and other kinds of interviews to get more perspectives into the process. Putting all of this input together, what tends to happen in this is people tell us what their needs are, and they tell us what the problems are, but we're also fishing for, what do you have as possible solutions? And so that's been that process. So it really is a matter of balancing out the needs and concerns for our employees, our parents, our students, and the operational capacity of the school system. And we can't do a plan that isn't balanced amongst these 4. So as we look at this balance, a majority of our parents really want kind of in-classroom instruction because of learning loss, quarantine, fatigue, inequities, need to return to the workforce, complexity on online learning, particularly with multiple children, and social, emotional, mental health issues. On the other hand, a majority of our teachers and staff want to avoid the health risks for themselves and their students from an in-classroom instruction model, but they're concerned about students adequately engaging in that, and they deeply care about learning loss. And they're also very worried, how can we do both in classroom and distance learning? Is that going to be just a workload nightmare? So how can we reach common ground is what we're aiming for. And everybody who's involved in this are dealing with issues related to these needs that are balanced. Workforce concerns for themselves and workforce concerns for parents and teachers, childcare issues, wellness issues, and learning loss. And the other driver on this is the personal safety and the instructional delivery. And underlying all of these, but this balancing act is whether or not we have the financial resources to do it. And right now that's a very important question, because it relates to whether or not we're going to get state funding at a certain level, and whether we're going to get federal relief at a certain level, and where we are with our own budget. The concept of equity and how we deal with equity in any model will be essential, whether we have the capacity and the bandwidth, if you will, to deliver, and with our labor contracts that we have with our employee organizations, because we have to, those guide the way we have to deliver certain programs and services and instruction. So it really comes down to a priority, balancing act, workforce demands versus personal health and safety. So our key question in ensuring healthy classrooms is, can we create a blended model using online instruction, synchronous, which means it's live, and asynchronous, which means it's taped, and have contact and check-in, with some in-school instructional support that can accommodate both our stay-at-home learners and our high-need students who cannot thrive in a homeschooling environment. So here are the biggest takeaways from all of the stuff we heard from students, and they were articulated very well by your team of parents and students who spoke earlier. Number one thing for everybody is safety first. The second is, let's focus on equity and not leave anyone behind. Let's avoid student learning loss. which means you got to figure out a creative way to continuously improve how we deliver distance learning. Be consistent, predictable, and proactive in both the way we communicate and in the way we program, and be consistent in applying and describing our instructional approach. Focus on the social emotional learning and mental health needs, wellness needs for our students. And the students were pretty strong on wanting to have options in the way they're graded and evaluated for how they do. Being able to select between pass and not pass and A through F. They should get credit for the hard work that they do, but they should not be penalized because they're at a disadvantage in trying to do that in a distance learning environment. So, take a curriculum that focuses on anti-racism and culturally responsive pedagogy and relevancy in classes. Make sure that our SPED and our EL populations are served well. And I'm going to be working continuously with those two populations of both parents and staff and others to come up with some creative options, some best practices that maybe we can reach as common ground. There'll be uniformity in the technological platforms, but we have to provide flexibility for teachers to be able to use the apps and the teaching support systems that suit their style and their content areas, and not one size fits all. The way you access education will be important in a consistency way, but the way they deliver it, they might have to have some options. And then training and professional development tailored to the needs of the individual. And one thing that I've been struck by is that everybody has a willingness to want to make this work. And that's, I think, a big pat on the back to the West Contra Costa community. So we have three pathways that have typically been around that everybody's looking at. Option one is you reopen schools, put kids in, and it has all of these downsides. Everything from fear of infection to expenses for enhanced screening to social distancing setup. Is this a non-starter because of social distancing constraints? If your schools and your classrooms are already overcrowded, it's hard to maintain distances of 6 feet between people. Number two is to simply remain closed and do 100% distance learning. And we all have talked about the issues that are associated with that. Is this a non-starter because that creates the equity concerns and quality of access and handling the downside of isolation? And option three is what you're hearing lots of different school districts explore, and it's hybrid models which rely primarily on distance learning, but they also have alternating days or weeks that kids are in school, split schedule classes, and grade level variations. However, all of these presume that we will have our students and our staff on campuses every single day. And we're going to have not every student, but we will have students. That picture of the 1918 pandemic doesn't really have an important factor in there, is that how many of the kids in that school, not in that classroom, had flu and possibly have died from it? How many contracted it? That was one school had they been collapsing classrooms. That's our fear. Our fear is that when we put kids and adults in harm's way, we bear a huge responsibility. So we're looking at a fourth option, and people are trying to understand this, and our job is to try to make this clear to folks. We're doing a blended approach where most students will get distance learning, and we will phase in exceptions to provide a better contact outside of their home for high need students. And we're calling these student support hubs, not a classroom, but we're going to try to staff those appropriately. And I'll show you another slide in a second that explains that a little further. And we will admit people into this based upon a tiered priority setting. Students that have high absenteeism during the spring, the underserved populations, either because of socioeconomic, maybe racial, maybe neighborhood, maybe access to Wi-Fi or whatever, our SPED population, our foster youth and homeless. Then what we will come back to is a second tier, which is students that had very minimal engagement, could not master the environment, or those which have pressing concerns regarding social emotional issues and mental health concerns. And then the third phase of bringing people in under this tier is to offer seats as needed for families who need that additional support. Interesting to note, in the surveys which the students actually did, and what the PLC did in terms of survey research, 50% of the parents said, I think I can handle distance learning. Another 25% said, I think I can handle distance learning if you provide me more support and help. So you have 3/4 of your population says, if you do a good job of telling me the ways that I can make distance learning work, I'll work with you to make it happen. So now we have to focus our attention on doing that well, while we also focus on the 25% who said, I'm having trouble with this, I gotta get back to work. Our kids are falling behind because they don't have the tools to learn, they don't have the self-motivation, they're getting isolation and other issues going on. So the question is, how can we bring those 25% along in a way that assures safety? And our conclusion was we need to focus in on how we get them to have a support system in a distance learning environment that might be outside of their home, but not necessarily open up full instruction in the school. So if you could imagine that what we're doing is we're kind of taking the homeschooling process out of the living rooms and dining rooms of some of this 25%, and providing them a place where we're going to try to staff that with qualified people who can facilitate and help them if they've got issues with wellness or technology or language or SPED or nutrition or attendance or academic needs. And we'll put them into a learning environment called a hub, which will be socially distanced and appropriate. And it will be as if we've sort of created, pulled together multiple dining rooms with qualified folks. So here's some presumptions that underline this. Number one, until a reliable and effective vaccine is readily available, schools are going to have to do some sort of distance learning. That's a given. And we cannot accommodate all students coming back to classrooms because of social distancing constraints. They just won't fit. The only way is to stagger schedules and limit them and do all the other things that other districts are taking a look at. But we're still going to need distance learning to work well, even under those blended models. And since safety is the highest priority, we still have a major segment of our students, parents, and staff who will resist returning to in-person instruction, even if we have clean environments. So we need to be prepared also that they're going to shut us all back down and we're going to have to go into isolation because the surge keeps swelling. Do we have enough PPE and safety materials to be able to even handle this kind of thing? Because there will be shortages that will start to occur in the fall. And then the stress of emotional health on students and staff will be a continuing problem that may escalate as isolation continues. So we need to have kind of an all full court press to deal with the social emotional wellness needs of our staff and our students. So if you take a look at this, we're doing a distance learning model. And I know a lot of people have said, are we doing distance learning? And the answer is yes, we are. And we're going to have students learning at home, and we're going to provide a lot of parent support and training and teacher support and training. But we're also not going to leave behind that 25% that say they're struggling. And so we're going to end up using these students learning and support hubs with facilitators and resource personnel and partnering with community-based organizations that may be able to help us with this process. Now, it works this way. If you can think of the teacher being in the classroom, all instruction is going to be delivered in a distance learning approach. Whether the teacher actually happens to be in one of these hubs because they're decided they want to operate kind of a mini classroom approach, or they're all at home in isolation delivering the instruction. And teachers, students will be admitted into this, and this is where we're going to have to work this through. In small cohorts, they can't be 25, 30 people to a class. And space will be based on our capacity to have these staff. And we're going to use a variety of people. They could be instructional aides, they could be childcare credentialed workers that have their permits, it could be before and after school workers who've been cleared and fingerprinted and all of that, as well as other staff that we have. And this can also be done with our community-based organizations. It'll be done according to student-centered needs, putting students into these learning hubs. And we'll need to have available to them for referral lots of intervention resources and personnel to help our needy students. And then we need to come up with a priority on how to staff that. And that's part of the details that our implementation teams will be working on. Collaboration and negotiation with our labor unions, who have been shoulder to the wheel in this whole thing, to reach and resolve staffing issues, workload issues, and contractual issues, is going to take place over the next several weeks. And so we need to make sure that what we produce works for every stakeholder. We provide distance learning with safety nets for people that can't take advantage of that. So here's some key next steps. We're going to gather final inputs from our stakeholders. We're going to roll this framework out. We're starting doing that now. The Board of Education's been briefed and gotten copies of all of this. They're going to be reviewing it again next week, this town hall. And I'm working with our SPED and EL working groups to hammer out optimal plan elements. We will draft this vision up to the board, and then we will share that with the county and the public. And then we will finally get our plan with many of the details available to be rolled out on the 20th. We're not too far behind the curve from a lot of other school districts. And one of the things is this becomes a big moving target as the health conditions in our communities change. If they get worse, we're going to have to be adaptable and flexible and be nimble in the way we adjust. And we're going to need to continuously improve and make adjustments as we go. So we're now shifting from the input phase and moving into the implementation phase. And we're going to convert that role of our subcommittees into implementation teams. And we're finding people that will assist many of the people who've been on the task force and others to come up with best practices and things we need to do to operationalize the plan. And we need to portray that in a way that is understandable to our publics and to our key stakeholders. And then finally, negotiations and conversations with our labor organizations. Now, we need to create those conversations in negotiations. The daily focus for students, which include things like direct instruction every day in both synchronous and asynchronous approaches, homeroom and advisory periods for social emotional learning, professional development time for staff, daily planning time, office hours with one-to-one interaction capabilities, limiting the number of classes that may be operating at any one time, making assignments linked to a common platform for you to connect as a parent and as a student, with the flexibility to use other learning apps and that sort of thing. And conduct virtual forums for student-to-student interactions so they don't feel as isolated. Other components will be social opportunities for clubs, working on our outside athletics, and we'll be moving pretty quickly in the area of what kinds of athletics will be allowed. Training and support for parents, counselor contact time, and time to discuss the key issues of race and equity and diversity and inclusivity so that we are having those deep conversations in the way we come back to school. So this changes what back to school looks like. And what we're suggesting is that we do back to school before you actually get back to school. And we're going to do instruction before instruction starts. There will be a soft entry, if you will, into what happens in the instructional program with relationship building between parents, students, teachers, and principals and others. A focus on that social emotional learning component and equity in relationships, and getting the tools and the mastery of distance learning modes during those first weeks. We're not going to jump in and give you algebra from day one. We're going to make sure that we have you connected to schools. That gives us a chance to troubleshoot problem areas and make adjustments, but also to screen and evaluate the needs of students as they're coming back. And then we'll try to do some things working with our principals, they're a pretty creative bunch, and their staffs to create student engagement activities, things that boost morale, that build affinity groups, school spirit oriented operations, and small coaching opportunities to help us all be in this together. So my big question to you in this town hall is this key concept. And that key concept is maintaining safety first through a distance learning instructional delivery system while providing students the support services for highest need families through these support hubs in a tier phased in approach to getting back to in-school instruction. And I would challenge the audience, will this concept meet your needs enough to get us through this pandemic crisis over the next several months? And with that, I think that we can all work together and make sure that every child receives the education they deserve going forward. And with that, I'll kick it back to your superintendent, Matt.
Thank you, Tom. Really appreciate that. And again, thank you for helping to compile many of the different resources, ideas, concerns, stakeholders. And just to be as clear as possible, this is our framework to return to school on August 17th with the majority of our students online doing distance learning, while the district works as hard as it possibly can to bring back our highest need students depending on our capacity and how many seats we can offer. And the more seats we can offer, the more students we can bring back, as Tom went through those tiers of how we would identify that need and criteria. So right now, that is our framework. Our idea is to fill in that framework over these coming weeks. What exactly does a week look like? What exactly do the minutes look like? What exactly do the classes look like, etc. And with that, we are extending this meeting till 7:30, and I'm going to invite Tracy Logan, who's our Associate Superintendent of Technology, our Chief Technology Officer, to help us with a tool to get your feedback on the framework that has been presented. It's a tool called Thought Exchange, and it will enable the 1,000 or so people in this meeting to collectively share thoughts in a very streamlined way, and we can see what's coming to the top for you. And that way we'll be able to put those concerns in a prioritized fashion and begin to address those. So again, thank you, Tom, for the presentation and articulating what we're doing and where we're going. And I'll turn it over to Tracy Logan for a few minutes to share how we're going to do this feedback part of the meeting.
Great. Thank you, Mr. Duffy. So we, as Superintendent Duffy shared, we will use a tool called Thought Exchange. And what we are asking is, what are some of the things that we need to address in order for you to feel comfortable with this framework for opening school? We know, as it was stated by students, by parents, and then through Mr. Delap's presentation, that it's a very complex time. We all want our students to be back in school. As a staff member and as a parent myself, I feel very much the same way. I cannot wait until we can have all of our students in school. And we also know, due to the complexity, that we need to do so safely. So please let us know that what are some of those things that we need to be sure to address in order for you to feel comfortable. So to do that, you can use your phone. There's a QR code on the screen. We're also adding the link to the chat. You can access it that way. or you can simply open up your computer and go to tejoin.com, it's on the screen, and enter the 9-digit access number, 153-526-8388. So I'm going to start the clock, and the idea here is that you can add your thoughts, and then you'll begin to see other people's thoughts, and you can rate those thoughts. Do those thoughts resonate for you, or do they not resonate for you? This is a completely anonymous survey. There are some demographic questions in the beginning that will just help us better understand who you are so that we can link your concerns with the students that you represent. So we'll take about 5 minutes to do this. So I'm going to be quiet. The chat is open. If you need help getting into the thought exchange, please do let us know. Again, the QR code you can use with your phone. And I should be sure to mention that this is translated in many, many languages. So when you get in, I'm going to move my screen for just a sec so I can actually show you. When you enter the thought exchange, it will look something like this, and then you get a drop down for language, and you can scroll down to your language, and it refreshes and is automatically in the language. And as you read other people's thoughts, they will be translated into your language, so that you should be able to both add your thoughts and comment on other people's thoughts. I'm going to go back to the login screen so everyone can see it. It looks like we've got 941 participants, 963. Of that, about 64 folks have shared thoughts, and we have 119 ratings. So it looks like many, many people are in. Now we're over 1,000. I'll stay on this screen for another 30 seconds or so, and then I'll move to another screen where we can all start seeing everyone's thoughts.
Okay, thank you very much, Tracy, Ms. Logan. Really appreciate you bringing this up. And this is not over. So if you want to keep filling this out right now, you can do so. We're going to keep this open until Monday. So you can continue to share your thoughts, a new thought, or rate other people's thoughts as well. Many of what we're seeing come up on the screen as top concerns reflect many of the things we've heard over the past weeks. And they are items and areas we'll continue to address. So, you know, what this does for us is it enables us, as you see on your screen, it brings up really the top issues across at least this group of people sitting in this town hall. A top concern is having materials and workbooks available and less printing. We see another one about safety being the main concern. We see another one about helping teachers develop online curriculum. So what our online curriculum looks like and what we end up doing in terms of how much printed material, that is all the work we have to do and have been doing over the previous weeks and coming weeks to make sure we can support students and families. Pressure on the parents, absolutely. This is an incredibly hard time. I know that as a working parent with my wife who is a teacher and us trying to scramble and make time for kids and get both of our work done. It is a really incredibly challenging task. Contingency plan, if there's a positive case at school, absolutely. We've had those in place through the spring. We will have those in the fall for sure, whether that's a staff or a student. This one is probably our #1 goal, creating a rich and dynamic distance learning curriculum. We heard from our students, we heard from our staff about this. And this is an important moment for me probably to pause and just really share that I am so proud of the work our staff has done over the spring, and especially our site leaders and teachers. They were asked to change how they teach overnight, and they rose to the occasion and worked tirelessly. And we're absolutely committed to continuing to support them. And I believe they will do an amazing job in the fall, taking what they've learned, pivoting and being even better. So I'm excited for that. And I know it's listed as a concern, but I have deep faith in all of our people, leaders, teachers, support staff to do some amazing work. We see anti-racist and equity trainings come up. And this is conversations we're having right now about just how much we can do. We'd like to do a lot in this area. And students are interested and deserve to know about what's going on in their world and have conversations to make sense of it. And we will provide those opportunities. So I'll stop there. We could keep talking about them, but our whole team will review this and really look at what's coming up on top and how it gels with what we've heard before and what might be some new concerns from this group. So, thank you very much, Ms. Logan. And again, that is open. It will be open through Monday, and we'll continue to draw notes and ideas and concerns from this tool. I also believe this evening we are putting potentially in our chat somewhere just a quick rating on how we did tonight in terms of this meeting. I really apologize for the late start. We thank you for so much community participation and engagement that we had to really restart. So again, thank you for being a half an hour late with us and staying a half an hour late. There is a feedback survey on just the process of tonight's meeting. You have the other places where you can weigh in on the opening of school. Our entire team and our Board of Education is very proud to support you and lead you in this process. We believe that we will meet the challenge to open successfully on August 17th. We'll support our highest needs students. We'll continue to find ways to bring students back into school. and we'll have a really detailed plan that works. We look forward to talking about this more at our Board of Education and hearing from our trustees next Wednesday, and get a more detailed version of our framework to our county a week from Monday. So again, thank you so much for being with us. Stay safe, stay healthy. Please give us as much feedback as possible, and we'll see everyone very, very soon. Thank you.